Do you need a pessary? Have you been to see the OBGYN and they said that you needed to have a pessary? You may have even needed to go see a specialist for this and they said that you needed a pessary, or maybe you know someone who got a pessary and you're wondering if it would work for you and what's going on with you. Well, ladies, today I am talking to you about who the pessary is helpful for, as well as answering some commonly asked questions like, does it hurt? Can I pee with it in? As well as giving you my opinion on if you need a pessary or not. Ready? All right, ladies. I'm going to talk to you real quick before we get into this video, because I feel like this is really, really important. So many women, when they talk to me about a pessary, they kind of look at me out of the side of their eye and they kind of talk to me out of the side of their mouth because they don't really want to talk about if they need a pessary or not. I don't know why this topic is filled with so much guilt and shame, but I want to tell you before we start, I need you to let go of the guilt and shame. There's no guilt and shame in needing a pessary. If the doctor has recommended it, if you feel like it would be helpful for you, I consider it like you're wearing a brace on your ankle. Now, if you sprained your ankle and you needed to walk around, would you put a brace on your ankle? I hope so, because it can be helpful and it can make things feel better and let you do what you want to do. Would there be guilt and shame with that? Well, I would hope not, okay? It's the same thing as wearing a brace on your ankle. If you need a pessary and the doctor has recommended it, there's a lot of great information in this video, but I need you to let go of the guilt and shame. Your self-worth is not tied to whether or not you have a pessary, all right? All right, back to the video. Okay, so why would you need a pessary in the first place? Most commonly, women need it because there's been a uterine prolapse, which means your uterus is pushing down through your pelvic floor. Now, what you'll notice is when you're washing yourself in the shower, you'll notice that there's kind of an extra bulge down there. That's usually what takes people to the doctor because they're very concerned about a bulge down there. And the doctor will examine you, and if they feel like there is a uterine prolapse, they may recommend a pessary. For some people, they may recommend surgery, but it depends on a lot of factors. So today we're just going to focus on that pessary. Now, what the pessary does is it helps to support the uterus and the bladder and the rectum. It's kind of like having a brace on your ankle. So think of it like if you've sprained your ankle and you need to put a brace on it to help support it while it heals. That's kind of the same thing as the pessary. Now, some women also will be advised to get a pessary if they're suffering with urinary incontinence. I will say I have not seen as great of results in regards to urinary incontinence with the pessary, but I definitely have seen better results with the uterine prolapse. Now, a lot of women want to know, is it painful to have a pessary inserted? So it's kind of like the first time you put a tampon in, if you can remember that. It's not really painful. It does feel a little weird, right? I mean, you're putting a new foreign object down there. It definitely feels a little bit strange, but it should not be painful. Now, the first time it's inserted, it'll actually be done by the doctor in the doctor's office. They'll do some testing to make sure that they've gotten the right size, and then they can help you learn how to insert it and take it out on your own. And again, every time you do this, it really shouldn't be painful, but it is a little uncomfortable while you're getting used to it. So that's just something to know before you go in. Now, how long can a pessary be left in? Technically, a pessary can usually be left in for 3 to 6 months, but how long you leave it in really varies by individual. I have had some patients who will leave it in for 3 months, they'll take it out, they'll wash it, and they'll kind of leave it out for a couple of days, let everything kind of calm down in there, and then they'll put it back in and leave it in for another 3 months. I've had some patients who only use it intermittently. So I had one patient who didn't want to use the pessary and didn't want to rely on it, but she would use it on days that she was going to be up and about all day. So if she was going to go hiking or go to the zoo with her family or something like that, she would wear the pessary for that, but she didn't need it on a day-to-day basis. So it was kind of for more of those higher level activities. So how long you wear it for is really dependent upon what's going on with you and your level of comfort with it. Again, it's not something that is painful, but it's something different down there. And so some people feel like, oh, I don't really like to leave it in for long periods of time. Whereas other people are like, I don't even notice it. I kind of forget it's there. I have to write it on my calendar to make sure to take it out every once in a while and kind of clean it off and before I put it back in. We'll see. Now, can you pee with a pessary in? Yes, absolutely. If you're going to leave it in for 3 months, I hope you can pee with a pessary in. And you can also poop with a pessary in. All of these things can be done with a pessary in. Now, the first time it's inserted for you by the doctor, because they want to make sure they get the right size. There's different sizes, so they have to see what size works best for you. That's usually a test that they'll do in the office, is making sure that you can pee and the pessary doesn't fall out. Because if it falls out, that would obviously be a problem. That would mean you have a too small pessary and you need a bigger one. So this will be tested while you're in the office the first time to make sure that everything feels okay. You'll get up, you'll walk around, again, making sure that there's no pain or anything like that. Because there are different sizes, the doctor will help you find the size that works for you. Now, as a physical therapist, one of the very common questions I get is, does a pessary make my muscles weak? Now, the truth of the matter is, there's no research on this, which is so shocking because it's something that only affects women. And I'm not going to get on that high horse today. But anyway, so we don't have research to know if a pessary actually makes the muscles weak. And I have had patients who have been concerned about that, which is why they don't want to wear it for long periods of time. So these patients will wear it for shorter periods of time when they're doing like higher level activities like hiking or going to be on their feet all day, but they won't wear it on more regular days where they're able to kind of transition between sitting and standing and stuff like that. Now, every patient is different in how much support they need from the pessary, but here's what I'm going to say. I was talking earlier about how I feel like the pessary is like a brace for your ankle when you have an ankle sprain. And there's a lot of people who believe that a brace on your ankle will actually make your ankle weak, but I don't believe that. I believe that a brace on your ankle actually helps to increase the proprioception, or the brain's awareness of that ankle. And I believe that it actually can help strengthen the muscles in that ankle. Now, of course, not having the brace is going to be more effective for strengthening, but when you need that lower level of strengthening because you have that poor proprioception, because you have that sprain that has led to that ligament laxity, having the brace can help you in those initial phases. I feel like the pessary has got to be the same because the pelvic floor is a bunch of muscles, and muscles don't change from one area of the body to the next. Again, my belief, which is not backed by research because there is none, is that a pessary helps to support the pelvic floor and can actually help lift it a little bit, which I believe will increase the strength because the muscle fibers are able to contract more regularly. Now, I've had some patients who only want to wear the pessary for higher level activities because they want to be able to do the exercises that I've given them in the clinic. And they feel like when they have the pessary in, they cannot do the exercises as well. That makes sense to me as well. So if you're working with a physical therapist, then I definitely recommend talking to them about how often you should be wearing the pessary and what your needs are, because everybody's different. So I can't give you a yes or no answer on this, but I can tell you from my personal beliefs about muscles and supporting them that a pessary will not decrease the muscle strength of the pelvic floor, but it may make it harder to do the exercises that you need to do to strengthen the pelvic floor. But you talk to your pelvic floor physical therapist and get their opinion. Which leads to the last question I usually get. Should I get a pessary? That's a really difficult question and really one that you need to be talking to your pelvic floor physical therapist to really understand if this is going to be something that's going to benefit you. Again, my personal view is that it's like a brace on the ankle, and sometimes your ankle needs a brace. And sometimes your pelvic floor needs some help. So if your pelvic floor is suffering and there's constantly getting this uterine prolapse, which is making the muscles lengthen out, which is making it harder for your pelvic floor to actually contract and relax the way it's supposed to, I have found a pessary very helpful for short periods of time. Now, I've also talked to women who they don't want to do that. They don't want to do the exercises. They don't want to do the pelvic floor physical therapy. They just want the problem solved now. And the pessary does do that. It supports that uterine prolapse, which decreases any symptoms that you're having, and it will keep it from progressing, because eventually it makes sense that your pelvic floor would help to be able to support, since it has that assistance of the pessary over time. And if you're okay wearing the pessary regularly throughout the day for the rest of your life, and that works for you, then fine, that will be super helpful. But if you don't like the idea of having to rely on a pessary, then find a good pelvic floor physical therapist who can help you get stronger and help you learn how to use the pessary to your advantage when needed, but not necessarily all the time. All right, ladies, I hope this video was super helpful. If you have used a pessary, I would love for you to drop a comment below. Tell us your experience on it. Help inspire other women. This is something that's not talked about often enough. So let's break that silence. Let's talk about it. Let's help each other. Have a great day, everyone.